Let's get started. Hi, everyone. Thanks for joining us, and welcome to Engage and Retain Strategies for Successful Patient Recruitment and Monetization. We expect this presentation to take around 30 to 35 minutes, and that's going to leave us with some time for some Q&As and to give you guys some next steps. This is our first ever webinar, so bear with us if there's any kind of technical difficulties. We're hoping to do a lot more of these in the future. I'm also going to be sending you the recording of this event after and any links that we talk about during the event. Just a heads up, sometimes these Google Meets take a while to process the recordings, but I'll be sure to send over that link as soon as we have it. But without further ado, let's introduce ourselves. I'm Lauren.
And I'm Janet. We're both from OptiMantra. For those of you who are new to us, OptiMantra is an EMR and practice management software company. And today we're here to share insights from the field that can help you engage patients, retain them, and improve monetization. We've worked with thousands of clinics, and one theme comes up again and again. Practices want more stability. Usually that translates to building a loyal set of patients who return consistently, who value their care, and who don't ghost after one session.
Yep, so today we're going to explore one of the biggest levers for long-term practice growth, patient retention and monetization. They're not just sales tools. We're going to give you growth strategies that'll work across cash pay and insurance-based practices. So we're going to walk you through 3 key steps that are going to elevate your patient recruitment and your retention strategy, whether you're just starting out or if you're looking to grow sustainably.
These are the 3 pillars we're going to focus on. The first one is meeting patients where they are, making sure your outreach matches how patients search and engage today. This includes online strategies for engagement building in-person momentum and driving referrals. The second pillar is designing recurring offerings. Creating structured packages are memberships that drive consistent revenue. We'll go over why recurring offerings are important, pricing and implementation, other perks, and common pitfalls that we see. The last pillar is driving success and tracking failures too, making sure you're using data to guide decisions, fix what's not working, and double down on what is. This includes collecting high-quality data, measuring success, and routinely adapting your approach. As we go through these 3 pillars, we'll share real-life examples of what we've seen be successful and some not so successful as practices across the country implement some of these strategies.
On that note, we're also going to outline for you guys a sample roadmap to launching a new offering for your business. This isn't about quick wins. We're going to show you how you can make small but meaningful adjustments that are going to drive improvements regardless of how sophisticated your existing retention processes are. It's about building a model that brings in the right patients, keeps them engaged, and gives your practice the foundation to grow with visibility into what's actually moving the needle there. First thing we're going to look at is meeting patients where they already are. So let's start with recruitment. To meet patients where they are, you need a strong online presence. And that all starts with creating a powerful conversion-driven website that's optimized for SEO. SEO is search engine optimization, and it's how Google ranks your content higher in search results. I'm going to hop into a different slide now to kind of break this down more. So on a basic level, your website should have a bio, your list of services with pricing if that's applicable, contact information or a form where they could submit a contact request, and some patient reviews. For patient reviews, you can have a QR code that's set up in your office that patients can scan to leave a review, and you can tie an incentive to that, like a discount on future services. You can also, through OptiMantra, send them a text asking them to rate their experience at your practice. Just a heads up that you'll need to do our 2-way texting add-on to be able to do this. If through the text they give their visit a high rating, you can then prompt them to leave a Google review. Reviews on Google are best to increase your ranking visibilities, especially with the local search. Make sure you've set up a Google business profile and that you've populated all of your basic business information, like your hours of operation, links to your website, your phone number, and your location. For your website, remember the more content you have, the better, but it needs to be organized coherently for patients into individual sections on your site. As you're building your website, invest in content that's going to help you rank better. Publish a few relevant content articles specifically on your differentiators. Strong content on your site indicates to search engines that you're an authority. So when patients Google something like IV treatment Denver, the search engine will prioritize your site. Something that I really recommend is just using ChatGPT to create these articles. Just make sure that you're changing up the text so that it's unique to your site and that you're tying in your business at the end. I have an example on this slide of a prompt that you can use. Just change it up so obviously it's more relevant to your practice. But you could see it says, write an article optimized for SEO about the best IV treatment in Denver and tie it to my practice. This is just going to spit out like a templated blog post for you. It should only take you 15 to 30 minutes to go in there, change it up, make it your own, and review it for any inaccuracies, and then publish that onto your site. The next step there to monitor how your search engine presence is performing is you can use paid tools like I have here listed, SEMrush, Ahrefs, or Moz. And these are going to show you what keywords you're ranking for on Google. It's going to give you suggestions for articles that you can write. And it's also going to show you what your competitors are ranking for. Those sites all give you a free trial, I'm pretty sure. So I recommend starting there as they can be pretty expensive. In terms of free tools, you definitely should register your site with Google Search Console and Google Analytics 4. This is going to give you basic reports on traffic to your site. And it's also going to let you know important details like how long are people spending on my key pages. If you notice that people are landing on your homepage and immediately leaving or only spending a few seconds on your service page, it means that you want to probably tweak some of the copy that you already have on there. But these platforms and these reports are all going to take trial and error. So it's important to carve out time on a weekly or monthly basis, depending on the size of your practice and your bandwidth, to just test different website content and see how it helps you rank and how people are engaging with your site. Okay, now I'm going to go back to the slide from before.
Thank you, Lauren. In addition to building a conversation-driven website, you should also be sure to create and maintain social media profiles. At a minimum, you should have a Facebook page and an Instagram account. These accounts should showcase your services and include testimonials from your patients. Have a new special or service, list them on the socials as an easy way to convey that to your patients quickly. And most importantly, all of these digital platforms should be connected to your online booking. The goal is to get patients to sign up. Through OptiMantra, you're able to create your own booking link tied to your services and offerings and embedded it right into your website. This makes for an easier experience for your patients and takes off some of the workload from your front desk staff. While so much of patient volume is generated online, don't overlook your local footprint. Make sure you're listed on directories and partnered with the local complementary businesses. Make a list of relevant businesses in your area and reach out to them. In person is always better. It's great to build relationships and see how you can promote each other. Lastly, if your budget allows, try paid ads, but track them. This is a way to rise to the top of the search rankings while you're doing the heavier lifting on SEO. If you're paying for digital ads, make sure you're targeting locally. You're spending on keywords that make sense for your business and that you have set realistic budgets. Set limits on your daily and monthly spend. We've seen clinics accidentally blow through hundreds of dollars in a day by not setting the right spending controls. As you're getting started, it may make sense to employ a digital marketing agency to set up your account and ensure you have the right barriers in place.
One of the most cost-effective ways to recruit is referrals. So that's just word of mouth from patients who you've already convinced and who know and love you.
That's right. In fact, a Harvard business study found that patients referred by friends or family tend to stay longer and spend more. So set up a simple referral program, make it easy for happy patients to refer others, and track those referrals in your EMR or CRM. You can even add perks or discounts for successful referrals. The most common perks we see are access to premium services or gift cards. Example, get a free vitamin C boost for every referral or $20 off your next service. But you can get creative here. We've seen clinics run raffles with prizes and other kinds of fun incentives. In Opti, for example, the clinics are able to record a $25 referral reward by creating a credit memo in the patient's account. Our software is designed to flag that patient has a credit to use on their next visit. Then staff can apply that $25 while the patient is checking out. Also, our analytics will track those referral rewards, how many patients received one, and when were they redeemed. The key is to make it simple for them to refer and earn rewards. What we've discussed so far is all about how you bring on new patients, which is very important. But we're going to switch gears to talk about how you can cater to these patients and drive as much recurring engagement as possible.
So let's take a look at retention. Acquiring a new patient can cost 5 to 10 times more than retaining an existing one. That's why recurring offerings like packages and memberships, which bring patients back into your office over and over again, are a smart move. Retained patients are also more likely to follow care plans and refer others, which we love.
These types of offerings promote consistent care as well as improve revenue predictability, which supports long-term financial planning, and a stable patient flow, which makes your scheduling more efficient. And don't forget, patients love the feeling of getting more for less. Whether it's savings, convenience, or access to exclusive perks, these offerings create a sense of value and belonging.
And while packages and memberships might not be super applicable to those not in the functional medicine or med spa space, just bear with us as we explore this section for a moment. There are 4 big benefits that we've seen when practices roll out packages and memberships. First one is better patient engagement and loyalty. Second, predictable recurring revenue streams, more streamlined service delivery, and a stronger value proposition that patients actually are able to understand. When these are done right, these offerings increase engagement, they streamline delivery, and differentiate your practice.
They also build trust. Patients feel they're getting value, and you gain a clearer view of future revenue. And it's not just theory. We've seen clinics double their recurring revenue just by offering one compelling membership. I worked in a large med spa, and while I was there, we rolled out membership programs, and the patients were so looking forward to their monthly visits. It changed the environment in such a positive way. It felt like patients started to see themselves as part of our community in a different kind of way, and we saw retention skyrocket.
Now let's talk about the structure of these recurring offerings, and we typically see 3 common approaches.
The beauty? These are all easy to manage, and with the right tools, they give patients options.
Yep, so we're just going to go over the few flexible models that we're seeing work really well. So the first one is service-based packages. That's bundling related treatments. So buy 3, get 1 free. Second is prepaid credits, where patients can pre-purchase credits to use at a later date. For example, that's like $100 per month, and then in 3 months, they have $300 towards their purchase. These memberships are like Christmas clubs, if you're familiar with that phrasing, where patients can save money and pick services that they want later. And then the third is time-based memberships. These are monthly or annual subscriptions with perks. Examples of these could be a med spa VIP membership, which would give you service discounts and product perks, or a healthy skin package that gives you monthly facials and discounts on moisturizers. You can also mix and match here. So you can have a membership that credits you $100 to spend on supplies and gives you 3 detox packages a month.
The possibilities are endless. You can easily build all of these in OptiMantra. And when staff knows exactly how each option works, you can offer customizations like pick any 3 of these 15 services. Just make sure that your staff knows what each offering includes so there's no confusion at the front desk. We recommend creating an internal cheat sheet to keep track of everything, but not going overboard.
Perks add perceived and real value. It's not just about price for them, it's about the experience.
Perks make people feel special. On the service side, think early or faster access to appointments, messaging directly with providers via the patient portal, exclusive discounts such as extra 10% off products or add-ons, loyalty points or rewards that are encouraging them to keep coming back. You can also give them free birthday gifts, bonus wellness content that might involve giving them having a gated area on your website with content, direct text support, and exclusive member-only events.
And by tagging patients in OptiMantra by their membership tier, it's super easy to manage the perks that you've set up, and your patients are going to start to notice the VIP treatment that you're giving them. Now let's look at pricing. So when it comes to pricing, make it easy for patients to say yes. So we're really stressing flexibility here. There's a few payment models that you can consider. Number one is upfront payment for packages. That's going to give you the cleanest tracking. Number two is monthly auto pay. Monthly auto pay gives you very predictable cash flow. The third is custom financing. This is really great for high ticket items, but I want to warn you that this needs tight tracking to make sure that you're not providing services that haven't already been paid for. If you start doing custom finance plans, we recommend ensuring that tracking these payments is someone's primary job responsibilities. And then you can also always just combine multiple payment models to suit the patient's preferences.
The custom financing model is a value add-on for clients, and they really appreciate it. But you need to understand that it adds work for your staff, and if you're not on top of it, you risk not collecting payments on services that have already been provided. We typically don't recommend adding that until you're at a scale where you can dedicate someone on your staff to manage these payment plans, or you risk losing more money than you gain from missed or disputed payments.
Yeah, I mean, of course, also give people flexibility when it comes to paying. So accept credit cards, HSA, financing, check. It's whatever works for your patient population.
Keep your offerings simple and your staff trained. If your front desk can't explain it clearly, patients won't buy in. Have a cheat sheet staff can reference, but that shouldn't become a crutch either. Every membership or package should have a clear name, clear service and perks, and a standard price.
Jen and I talk about this all the time. Simpler is better. Every person in your practice needs to be able to explain to a patient why they should opt into a specific offering. And you don't want to overwhelm or confuse patients with choice. We call this analysis paralysis. Use tools like your EMR, loyalty apps, or your CRM to stay really organized. And when everyone in the clinic can speak to your packages, they can promote your packages. So then your staff is becoming your top proponents. So the flip side of our implementation tips, we see some common pitfalls that can really hurt your growth and patient engagement as well. So I'm just going to go through some of them that we see. Number one is overcomplicating the structure. This is when clinics try to have too many offerings and too many perks in one package, and it becomes too difficult to explain and track. The biggest mistake we see are clinics adding too many packages too soon. We once consulted with a clinic that had 9 membership tiers and levels. They had confusing names, really complicated perks, and it tanked, honestly. We ended up working with them and simplifying it to just 2 clear offers, and their enrollments jumped 3x in the first month. Another pitfall we commonly see is not tracking usage or value. Tracking is so important. Janet will tell you, she is our tracking queen. You want to understand whether patients are actually utilizing your packages, because you need some usage in order for them to actually stay engaged and keep using the package. But you also want to make sure there's no abuse. For example, if you have someone that's coming in and using your infrared sauna every day. This is also essential for your financial reporting and your tax liability. Unused package balances may be considered deferred revenue, which affects how you report your earnings. You should ensure that package balances are counted down directly and associated with super bills for your patients, so providers and staff can easily track the usage and remaining sessions. You'll also want to make sure that you track down not just package usage, but that how that impacts the outstanding dollar liability as well. We also recommend that you set up notifications for patients to remind them of unused sessions before they expire, or create text and email campaigns to engage those patients, helping maximize engagement and minimize service gaps. Finally, we also think that you should establish clear expiration policies while allowing case-by-case extensions for exceptional circumstances, ensuring compliance while maintaining a patient-friendly experience. It's also super important to clarify the terms of the packages and memberships to protect yourself against disputes. Offering high-value packages and memberships really increases your exposure to transaction disputes. A dispute will occur when a patient claims that they didn't authorize a charge and asks their bank to reverse the transaction. These disputes, called chargebacks, can happen months after the original purchase was made, sometimes even after the patient had already used the service, which is tricky. Since the patient's bank ultimately decides if the dispute is valid, you have to proactively protect your business by making sure that you have rock solid proof of their purchase and your agreement terms. I'm just going to hop to a different slide here to give you an outline on how I recommend you do this. So this is how to protect your business via terms. Number one, get signed consents at the time of purchase. Clearly outline your refund, cancellation, and expiration policies in writing. Use a signed consent form, like the one available already in OptiMantra, to ensure patients acknowledge the terms before they purchase. You should specify service restrictions and commitment periods. So this is defining any restrictions or limitations. For example, if your offer is non-transferable, or if there's expiration dates or cancellation penalties, make sure that they're seeing those. You should also make sure that membership terms, including auto renewal and minimum commitment periods, are clearly communicated at that time of purchase. Also, take initial payments in person when possible. Collecting the first payment in office via a physical card terminal, like those integrated with Fiserv and OptiMantra, helps establish that the card was physically present, which reduces fraud-related chargebacks. You should also maintain detailed documentation. That means keeping records of all your patient communications, invoices, and your signed agreements. If a dispute arises, submit strong evidence like signed contracts, usage history, proof of in-person payment to improve your chances of winning your case. Okay, now I'm going back to the slide from before.
You mentioned super bills. Super bills is the word that we use for receipts for the patient. It's great to track what the patient used on each visit. They have a receipt. They can turn it into their insurance company if need be. And if you ever need to reference it, you have it already on file.
Yes, super bills are your best friend.
Other pitfalls to avoid, though, are lack of team alignment. Typically, lack of team alignment looks like different messaging on the value proposition of your packages from different members of the team. This can be confusing to patients or even make them question the value of your offerings. Another one is poor communication during the rollout. Team alignment is often tied to poor rollout communication. We've had clinics where new packages are rolled out, but some of the providers aren't even aware of it. Unclear value for the patient. The more explicit you can be about the value of the services, the better. We recommend tying the value directly into the name. Hydration package clearly explains what the outcome is. And not too much selling. It's always a fine line between educating patients about your new service offerings and being too salesy, which can be off-putting to patients. Discuss where in the patient journey you will be educating patients about the new offerings. Example, you want to avoid the front desk staff, the provider, and the billing staff all pitching the same client in the same visit. And then find non-intrusive ways to keep the offerings top of mind, for example, in your newsletter or posters in the office. As clinics roll out new offerings, one of the most common pitfalls is lack of promotion and tracking what is and isn't working.
I always say, if you build it, promote it. In order for things to stick, people need to hear about your product offerings multiple times and through multiple channels. So here's a few things that we typically suggest. You can include your promotions and email blasts to your patient base. Only caveat there is I would make sure that your offering is interspersed with also educational content. So there's a value add to the patients as well. You can put them on your social media. So develop profiles on Instagram, Facebook, and TikTok, and include new offerings as callouts. Again, interspersed with that non-promotional content as well. You can have flyers in your clinic. We recommend you just keep them at your front desk and hand them out to patients checking in or checking out. And then a popular one too is just having a website pop-up or a digital banner right on your website.
Be sure that your messaging is consistent across all your channels. And don't forget to brief your team. Everyone should be able to answer, "What's this membership thing I saw on Instagram?" You can even role play the pitch with your team. Confidence is key. I'd love to tell you about our new wellness membership. It includes a monthly visit and exclusive perks. Are you interested in hearing more?
Yep, practice, practice.
Before you roll anything out widely, pilot it. Offer it to a few local, loyal friends and ask them for their honest feedback.
Yeah, you can use short surveys by text or email. You can ask what they liked about it at a first glance, maybe what confused them, and what would make the offer more valuable or enticing to them.
You also want to ask, how did you hear about us? And document that in your EMR OptiMantra. Train your team to ask every patient how they heard about you. If a certain referral source is crushing it, lean in. If you're paying for the ads, make sure they are paying off.
And you could track referral sources right inside your EMR CRM. And that visibility is going to allow you to align your marketing with what is actually working. And then you can use your feedback from your clients to refine your package offerings and improve their satisfaction.
A good checklist to abide by for tracking is this. 1, to use email or text surveys after the visit. Or 2, ask, how did you hear about us? Then you'll want to track that referral source in Opti. One quick way could be with the tagging system that we have for the patient's accounts. So all the staff can see that this patient has already answered this question. Finally, you can use the insights to guide marketing spend. If a magazine ad runs and then there's 5 new patients that stop in the next week, is that a good return? Or do you need 10 new patients to make it worth the cost?
Mm-hmm. We're going to dive into the tracking here a little bit more. So like Janet mentioned, tracking these referral sources are incredibly important, especially if you have a referral network that needs to be paid out. So let's take a closer look at what to track, where to track, and how. So as for where, you can track these in your CRM or your EMR system. You should be looking to track is your source. So source is how they found your site. So that slot should say something like paid ads, Google search, ChatGPT results, patient referral, etc. Your medium, and these are specific things like the email or banner ads, and then your campaign names, something that you name it internally for your tracking purposes, like Spring 2025 promo or July 25 webinar. How you set up this tracking is through UTM links. There are a few free sites that help you create these links super easily. I'm going to include one of them in the follow-up email that I'm sending. In OptiMantra, there's a few advanced tracking options you could set up as well. These are for more of our tech-savvy practices. This includes tracking digital ad performance through Opti's booking calendar. You can use tracking pixels, and you can configure Google Tag Manager to record the actions that are taken through UTMs and reflect them back into that Google Analytics account. This can be complicated and advanced, so we recommend with people just starting out by asking, how did you hear about us, like Janet said, and tagging those in your Opti account or your CRM. But for our more adventurous folks and who want to do the more advanced tracking, I'm going to send our knowledge base article over that shows how you could set up all of these pixels and the tracking in Opti and feed it back into your Google Analytics account.
Now that you've put in the time, you need to determine if it's paying off. You can't improve what you don't measure. So what should you track? First, enrollment rates in your memberships and packages. How are these changing over time? Are certain patients more likely to take you up on them? Next, you'll want to look at the revenue and margins generated from these reoccurring services. What are your best-selling services? Promote those more. Patient retention rates and repeat visit rates are another thing that you can look at, along with the reduction in cancellations and no-shows. And of course, patient satisfaction and feedback trends.
I think the easiest thing to look at is, it's working when your cancellations go down and your repeat visits are going up. So make sure you're reviewing your cancellations too. When your retention improves, no-shows and drop-offs will typically go down as well. Now that we've gone over the foundation of creating a new offer and the risks and what needs to be tracked, let's talk about how to get started. So where do you start? Don't overhaul your entire patient experience at once. Just choose one new offering to launch this month.
It could be a simple package like bundling 3 of your most popular services or a new reoccurring membership with perks. The key is to keep it focused and make it easy to understand. You will need to decide on pricing and perks, then train your staff so they can confidently talk about it. Promotion doesn't have to be complicated. Just make sure you're hitting at least 3 channels. Then track the results for 60 days, gather feedback, and go from there. It doesn't have to be perfect. It just has to start.
And this is just your foundation. So start small, but start smart. Use your EMR to track who's buying, what they're using, and when to follow up with them. But make sure you're setting up a roadmap where your system is doing the heavy lifting for you. All right, to wrap it up, 1, make sure you're meeting customers where they are through your new optimized website, your social platforms, and your online listings. 2, packages and memberships can transform your revenue model and help patients stay engaged and invested in their health. Careful planning, implementation, and tracking are crucial for success, and utilizing proper tools like OptiMantra can streamline your process.
Start simple, scale with feedback, and make it easy for your staff. You'll be amazed at the results. Let's take a minute now to look at the chat, and if anyone has any questions, please add them to the chat.
Yeah. I saw Nicole asked earlier if we were recording this, and yes, we are. We're going to send a YouTube link after this. It does take sometimes for a meeting this long a while for Google to process. So once I have that recording, I'll upload it and send it over to you guys. Sure, the second to last slide. This one, getting started. Any other questions?
We have some raised hands from earlier.
I think that was the mistake that I always make, where when I said, can you give a thumbs up, that hand, everyone clicked the hand, which it's misleading. All right, if there's no more questions, I just want to challenge you all to build out your digital presence and create new packages or membership offerings. Share your success stories with what is and what isn't working. We have a Facebook users group. It's called, I think, OptiMantra Official Users Group. I'll send a link to that too. I'm in there. I can answer any kind of marketing questions that you're going to have. And just share what's working and what's not. I think people are going to really enjoy hearing your success stories. And we're just here to help each other. For next steps from us, keep an eye on your inbox for an email that's going to contain the event recording. And I'm going to give you guys a guide for 38 places to list your business for best visibility. Oh, and Colleen, thank you very much. Just sent that link to the Facebook group. You guys want to send a request, I'll accept it right after. For our non-Opti users, I'm also going to send you a link to a free trial and a link to schedule a demo so you could check out OptiMantra and see how it can help you grow and structure your practice for success. And for our Opti users, I'll send that KB article on setting up your marketing conversions.
I also wanted to add that for Opti users, we have free office hours every day, or every day there's an hour office hour. You can hop in and ask questions. Yes. They'll demo things for you. We have the knowledge base. We have weekly training options up at the top of the program. So make make sure you take a look. I work with the payments and the analytics a lot, but we're here to help in any way that we can.
Great call out. All right, well, thank you guys for taking the time today. Feel free to reach out to Janet or myself if you have any questions or if you want to discuss any of this further.